we've talked about the bundles, but I think it bears saying that there are actually 4 bundles that AIM-CCI offers. We offer the postpartum bundle, which we talked a little bit about already. There's the maternal mental health bundle, which some people would say, why would you need a separate bundle for that? Why would you not just put aspects of mental health in all of the bundles, which we do. It's one of those foundational elements that we spoke about before. But women of color are really suffering specifically from mental health issues that are associated with not just diagnoses, psychological diagnoses, but also environmental factors. We know 8% of women suffer from a mental health diagnosis, but a third of those women are specifically women of color. So Sue, would you like to talk a little bit about the nuances of that and the environmental factors that take place in terms of impacting our mental health specifically that may not happen with other women?
The reason that we developed a maternal mental health patient safety bundle was because from day one, we heard from our pilot sites that depression, anxiety, and stress were key issues affecting all of their communities and impacting maternal health. And the evidence really bears that out. The literature bears that out, as illustrated by the statistics you just stated. So one of the things that I think sometimes gets missed in terms of assessments for mental health is the context of environmental factors, not only what's happening within the community or what's happening in the woman or birthing person's life, but also what's happening in the larger community, in our country and in the world. And so if someone is coming into my office as a clinician and I don't recognize that this person may be experiencing those stressors and interpreting those stressors very differently from my experience, it's highly likely that I could miss signs and symptoms or miss an opportunity to truly understand and provide resources and referrals that could be helpful. So some of the things that we address in the AIM-CCI Maternal Mental Health Bundle are looking at that community context and helping better to understand the stress. And I would say that goes hand in hand with the RELS series and really starting to unpack and understand the different experiences that women birthing persons and their families come to us with as clinicians.
I think it's about using the trauma-informed approach, but also elevating that. We're all accustomed to hearing about interpersonal racism or bias, but we really need to be looking at it systemically, the systemic racism, the systemic bias. And, Dr. Fleta Mass-Jackson was one of our content experts who worked on the maternal mental health bundle. So it's really important, like Sue said, to make sure that if a woman presents in the office, while there may not be anything going on in the community that she's placed in, you have to think about what's going on in society right now that also might be impacting her stress level, her anxiety level, outside of the normal conditions that you would check a box with in terms of your diagnostic assessment of what's happening. So I think having information about that, making sure that's infused in every assessment, that's really the reason why there needed to be a separate pullout, although it does go across all of the bundles and making sure that women are, yes, being assessed for postpartum depression or assessed for anxiety, elevating our process and how we assess women, not just looking at potential interpersonal racism, but understanding that systemic racism is impacting our day-to-day lives. So when you say trauma-informed approach in the context of AIM-CCI, it's not just personalized trauma, but trauma that can be experienced because you may witnessed or heard about something else. These are nuances that add stress. Dr. Fleta Mass-Jackson talks about all the time the weathering of stress in her work and how stress plays a part in Black maternal health and is really. So we're not just doing PHQ-9s and just evaluating for depression as if it were in a bubble. We're really taking it and looking into the context and the totality of a woman's life and everything she could be experiencing at that time to make an assessment of how we need to approach and how we need to move forward.